Medical terminology is fun. Today we will examine the basics of psychiatric terminology. There are two primary characterizations of personality, mental and behavioral disorders. An organic disorder is a form of decreased mental function due to conditions associated with brain disease and due to medical or physical diseases rather than psychiatric illnesses. Examples include dementia or Alzheimer's disease, the results of encephalitis, meningitis, hypoxia, brain injury, or chronic drug abuse and alcoholism, where the brain is affected. A functional disorder is a form of decreased mental function with no known organic basis, but they are believed to be a result of psychological factors such as emotional conflicts or stress. Examples include antisocial behavior, phobias, and personality disorders. In either case, these disorders may cause significant distress, disability, or an impairment in areas of social functioning. Phobias are an extreme or irrational fear of or an aversion to something. We'll start with claustrophobia, which is the fear of small or restricted spaces. Studies show that 5 to 7% of the world's population suffer from claustrophobia. Next, we have aerophobia, the fear of flying. Again, 5 to 7% of the world's population suffers from aerophobia. Take a look at acrophobia, the fear of heights or falling. 10% of Americans suffer from acrophobia. Next, we'll look at mysophobia, otherwise known as germophobia, the fear of germs, which usually results in chronic hand washing. And finally, we have another phobia, glossophobia, the fear of public speaking. Now we'll look at personality disorder. Personality disorders are characterized by poorly adaptive personalities who demonstrate impaired social functioning. When we look at personality disorders, we can categorize them in basic terms. First of all, we have the antisocial type. This is when an individual has chronic antisocial behavior in which the rights of others are violated. Next, we have the narcissistic type. Narcissists have interpersonal problems which arise due to an inflated sense of self-worth. We have the masochistic type. A masochist is gratified by inflicting pain and suffering on oneself or others. We also have obsessive-compulsive disorders. Individuals with obsessive-compulsive disorders often have a preoccupation with extreme orderliness, perfection, and control. When we look at personality disorders, we have to continue several other categories. Pyromania is a deliberate fire setting which brings a sense of self-gratification. Next, we have pedophilia. The pedophile is an adult who is sexually attracted to and or involved with children. Kleptomania. The kleptomaniac has a chronic condition of stealing objects not needed for use or monetary value, but just to steal objects. We have some eating disorders. One is anorexia nervosa. An individual with anorexia nervosa has an eating disorder due to an extreme fear of gaining weight, and they typically will not eat at all. Another type of eating disorder is Bulimia nervosa. This is binge eating, followed by self-induced vomiting and or the use of suppositories or enemas. Anxiety. All of us experience anxiety from time to time, and it can be helpful to sharpen our wits. Anxiety is classified as a fear of the unknown, a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Anxiety is categorized as well as a nervous disorder by excessive uneasiness and apprehension, typically associated with compulsive behavior and or panic attacks. Psychoses is a very broad term that covers many different symptoms and experiences. Common symptoms of psychoses include hallucinations, and it's important to differentiate between a hallucination and a delusion. A hallucination is seeing, hearing, feeling, or tasting things that other people don't. Oh my gosh, look, there's rats everywhere. Yet there are no rats. Delusions are false personal beliefs based on incorrect perceptions about reality, which are inconsistent with culture and previous beliefs, and which are firmly sustained in spite of evidence or proof to the contrary. An example of delusion would be, they're out to get me. Everybody's staring at me. When in fact, nobody is out to get them. Individuals with psychoses often feel overwhelmed by sensory information. The lights seem too bright, the noises are too loud. This can trigger confusion, frustration, and agitation. Individuals with psychoses have difficulty filtering stimulation from the environment and separating it in their mind. Individuals with psychoses have difficulty at times doing very ordinary things. And psychoses often includes problems with memory, attention span, and putting thoughts together. Finally, individuals with psychoses have periodic difficulty with understanding and functioning in what most individuals perceive as reality. Just who experiences psychoses? Anyone can develop psychoses. Many people see or hear things that others don't, or have ideas that are very unusual. Psychoses is only a problem when it's causing you or somebody close to you significant distress or harm. Psychosis affects approximately 3 in 100 people and usually occurs for the first time between the ages of 15 and 30. Men often develop psychoses 5 to 10 years younger than women. It can be caused by a variety of medical illnesses, sleep deprivation, severe distress or trauma, drug reactions, a genetic predisposition in the family, and other factors. In summary, there's a lot of promising news about psychiatric disorders. Many become managed or can become cured. For example, anxiety typically can be overcome after a fearful event or through talking with others that are skilled in assisting individuals with chronic anxiety. Phobias many times are overcome with psychological help and a willingness for an individual to take the necessary steps and face specific fears. Finally, psychoses. The signs and symptoms of psychoses, such as schizophrenia, bipolar disease may be easily managed with psychological intervention and or the appropriate medications. Thank you.